Hi guys, welcome to another episode of Clouds of Podcast, where we dive deep into the untold stories of pioneers who are redefining healthcare. Today we have a very special guest, someone who has not only revolutionized diagnostic imaging in India, but has also played a crucial role in public health initiatives and medical entrepreneurship. Dr. Rijo Mathew is the director and senior consultant radiologist at Amma Scans, one of the Kerala's most trusted diagnostic center, a leader in the field of radiology. He has served in multiple key roles with Indian Radiological Imaging Association (IRIA), including as the Kerala State President and National Honorary Treasurer. Beyond his clinical practice, Dr. Mathew has been instrumental in shaping national initiatives like Samrakshan program, a program which is focusing on preventive radiology, and he is a founder and national coordinator at Samrakshan project to reduce perinatal mortality in India. So it started around 2019 to 2021. We'll be talking more about it in our talk. And he is also a MR safety ambassador and with AOSR. And I mean, if I keep talking about what he is, I'm sorry. I mean, there's a lot to talk about. You, I think we'll talk about it in our course of this podcast, right? Thank you so much for coming, sir. Sir, so there's a lot that you're doing in your life, and please walk us through your beginning in, during your early days. How did you get into all this? What was your passion? Uh, were you always passionate about taking up radiology? How, all that, like just walk us through your.
Thank you, Dr. Profula. I'm happy to join your glows of this podcast, which is interviewing some of the important people in the radiology field. See, the radiology, I can't say that radiology was a passion for me to begin with because everyone was writing the All India entrance and entrance examination. I too have taken the entrance examination. And luckily for me, the ranks were good enough to get radiology, and that is how I landed up in BJ Medical College, Ahmedabad for the MD. And there, the interaction with some of the pioneers like Dr. Harsha Shah, Professor Harsha Shah, who was my PG teacher. And after my post graduation, I had the chance to be a registrar at Jeslock Hospital, Mumbai, where again, the pioneers in radiology were my mentors, Dr. Srinivas Desai, Dr. Anirudh Kohli, Professor Mugun Joshi, Dr. Nitin Chaubal, Dr. Chandalulla, the biggest names in radiology in the country were the teachers and the faculty there. And interactions with them gave me a better insight into radiology. A passion developed during the interactions in PG postgraduate days as well as my registrarship. That is how, and I came to know more about the Indian Radiological and Imaging Association, as these pioneers were part of the Indian Association at that time in a very big way. And these interactions certainly helped me to give a better insight into the not only into the profession but also into the activities of the Indian Radiological and Imaging Association.
Nice. So you're doing something about preventive radiology, and do you think in your early days of your residency, or as you mentioned, how did you develop the passion, or about doing it? Is there any story behind it?
See, if you look at the history of modalities that have developed, now from till 1980s, it was the conventional radiology that was the mainstay of radiology. Then came ultrasound and color Doppler. So maybe for 1980 to 2000, ultrasound started dominating, and those who were doing ultrasound and color Doppler were the cream of radiologists who were doing it. But from 2000 to another 10 years, now then we saw cross-sectional imaging specialists with CTMR gaining the upper hand in radiology. They're becoming the most sought after people. And that is ever changing also. Now it is interventional radiology that is coming up in a big way, that those who are without interventional radiology, you are not going to be labeled as a radiologist. That's a kind of thing. Maybe for the next 10 to 15 years, That will be the kind of moment. So everywhere it has happened, every 15 to 20 years, some modality in within the radiology starts gaining upper hand, and a lot of the practitioners will start gaining skill enhancement within that. So that is how it was going on. But then this branch of diagnostic radiology and interventional radiology were well established by this time in 2020. And that was during the presidency of Dr. Professor C. Amarnath. We thought of initiating a program called as Preventive Radiology, because that has got a larger dimension to it. That an asymptomatic how can we identify an asymptomatic high risk group of individuals, especially for metabolic dysfunction, endothelial dysfunction, for heart disease, liver disease, kidney disease, and stroke, neurodegenerative disorders, etc., at a much earlier stage, much before they become symptomatic, with the help of radiology tests and radiology and imaging biomarkers. And that's how this thought came across. So I must honestly admit that the program that of Samrakshan that we did for screening for preeclampsia and fetal growth restriction, which we initiated in 2019, for identifying those mothers and babies who are at risk for developing preeclampsia and fetal growth restriction. And once we identify them with the help of Dopplers, mean arterial blood pressure, and the clinical parameters, if by a 150 milligram of low dose aspirin, we were able to reduce the incidence of preeclampsia and fetal growth restriction by 80%. We proved that in the Indians, with a lot of Indian studies also, nearly 36 publications have come out with the multicentric publications all over India. And that gave me at least a confidence that screening with radiology biomarkers has got a huge potential to identify those high risk group of individuals with non-communicable disease, especially the heart disease, liver disease, kidney disease, and stroke and neurodegenerative disease, and also cancers. So these are the main, and by this time, as a country, India, from a developing to developed nation, is already showing signs of mortality more due to non-communicable diseases. So we are seeing a patient load who has been worked up for diagnostic. This thing when they come to a physician or a cardiologist or a neurologist with a symptom. But it is time for us, if we truly want to reduce the mortality due to non-communicable diseases like cancers, heart disease, liver disease, etc., we need to identify them when they are at a asymptomatic stage. Who are the high-risk group of individuals, and how can radiology tests like ultrasound, elastography, Dopplers, CT scan, MRI, all these tests can be useful to identify that. And at the same time, radiology has already evolved into intervention with minimally invasive therapies. If we have identified them at early stage, their survival and better quality of life is also possible. That's how this thought process came in. And preventive radiology has initially concentrated on imaging biomarkers of, or radiology and imaging biomarkers of metabolic dysfunction. We were all doing USG abdomen, and many a times for last 30 years US fatty liver was something that radiologists were telling the whole healthcare system that fatty liver is the, but we were not totally aware of the uh, consequences of a fatty liver. After 2010, people realized, the healthcare system realized, non-alcoholic fatty liver, which was still then considered as an innocuous or a relatively innocent thing, leave it alone, don't do anything. But it has started creating problems in the terms of uh, cirrhosis of liver.
Cirrhosis.
And maybe from 2010, if you look into liver transplants, the etiology of liver transplant, causes of liver transplant, 3 out of 10 liver transplants has happened due to non-alcoholic fatty liver disease, now which is called as metabolic dysfunction associated fatty liver disease. So it is not alcoholic fatty liver disease; it's on the rise, and a combination of this with alcoholic and non-fat fatty liver disease, metabolic dysfunction associated fatty liver disease, which is going, it's becoming a major uh, healthcare burden.
Yes.
If we don't address it now, what are the consequences of that 20 to 30 years down the line? The whole healthcare system in this country has to train more and more surgeons to do liver transplants.
Yeah.
So that is, and where are we going to get all those livers for the transplant also? So it's going to be a very challenging situation, and that is how the relevance of preventive radiology comes in. With the help of preventive radiology modalities like ultrasound, elastography, and all these things, we can identify those group of individuals with fatty liver who are likely to go for cirrhosis or early stages of fibrosis, because liver elastography, 2D shear wave liver elastography is a test that can quantify the liver tissue stiffness. And once if it is on the higher side, they get a window of opportunity to reduce it. It is reversible in the early stages by lifestyle modifications or by medical interventions or with some medical therapies, maybe nutritional supplementations, etc. You may be able to reduce their risk. And downgrading of that risk for non-communicable diseases is first and foremost point, first and foremost objective of preventive radiology. Secondly, this early detection. We don't want to see a cancer at a stage 3 or stage 4. By that time, nothing much can be done. So, detecting them at very early stages improves the cure rate and the quality of survivors. The cancer survivors, if we truly want to, and there is enough proof for that. If you look at the mammography being made mandatory from 1971 in the United States, 50 years down the line, that has significantly reduced the significantly reduced the mortality due to breast cancers in the United States and increased the pickup of early detection of breast cancers, thereby contributing towards the quality of survivors in the whole United States. So that's a radiological test. Mammography is a radiological test. Now we are not recognizing that. That is how the scope of preventive radiology. Similarly, for heart disease, you can screen them at asymptomatic individual who are already has got a family history or the dyslipidemia or hypertension or diabetes. You can screen them with CT coronary angiogram, calcium scoring, and for the intima media thickness with ultrasound, reactive hyperemia with Dopplers, all these modalities can be put into use, and you can quantify that risk of individual for cardiac disease much before he becomes symptomatic. That is the true potential of preventive radiology.
So, preventive radiology is really a game changer in health sector. But I mean, we all know that not many are aware about this. Like it's out there, and as you mentioned, in case of non-alcoholic fatty liver or non-alcoholic fatty liver transition to cirrhosis, I mean, we all know that it's a larger threat because if it's an alcoholic, which is something that is reversible on the abstinence of alcohol, and where non-alcoholic fatty liver is something that's a challenge that is being faced by the Indian community. So where the preventive radiology or the early screening plays a crucial role.
See, early screening make them aware. Previously, they were not aware that this is causing a problem for this. So,
Yeah.
awareness is the first and foremost. And then you can counsel them for lifestyle modifications in the sense that that is part of the preventive radiology program that we have initiated two interesting programs. One is Hidam Midam, that is Hidam Midam Samayam, that is our food type, food quantity, and the timing of our food has to change. The second thing is increase the exercise activities, the games, and the physical exercise. Third is habit changing counseling centers. It's not easy to change your habits, so you need some kind of a support from counseling centers, a collective effort from the governments, non-governmental agencies, and also from the community. So we need to think in those lines. But there, once we are aware of this high risk group, a lot of medical interventions are also possible. A lot of new innovations can happen in terms of gene therapy, in terms of drug therapy, in terms of something new that can come up, or even bariatric surgeries can be widened up, can be widely applied. Those cases with a very high in BMI and very high risk, whose risk can be brought down with several medical interventions too. So the fundamental thing is the patient has to be aware that I am in that high risk group. So that is what preventive radiology intends to do. With the help of a radiology test, we are going to stratify the risk of that individual, make them aware, not only them, the medical community too. Because right now our orientation is more towards a diagnostic workup or an interventional if something is picked up. But we need to change our perspectives more towards a preventive perspective, where we are want to identify, suppose when opportunistic screening is possible in a CT scan, if you are doing for either for a diagnostic workup, you can quantify the visceral fat, you can quantify the liver fat, and can inform, you can quantify the epicardial fat, and that can inform that individual you are at a higher risk of having a metabolic syndrome. The current diagnostic criteria for metabolic syndrome of dyslipidemia, hypertension, diabetes, and obesity with waist circumference. That's not enough to identify the truly high risk individual for metabolic syndrome who is more likely to develop a liver disease, a heart disease, etc. That is why we have started with a fatty liver screening program and elastography program, and saying that fatty liver is a radiology biomarker not only for liver disease but also for cardiac disease, because 63% of fatty liver disease patients are going to have coronary artery disease, and that may be the cause of their mortality or death. So it's time for them to understand, make them aware, and do some modifications on their lifestyle, and medical interventions are possible. So that is the true potential of preventive radiology, and that can make a huge public health impact. And of course, the health expenditure of the country and this particular individual also can be curtailed if you do this kind of intervention. So that's a true potential. This is an evolving stage. Awareness needs to be created. It's only 4 years old. It's an Indian contribution to the healthcare, especially from the Indian radiologists. And that is, as the awareness and the programs take shape, more and more explorations into the research take place, we are sure the radiological tests are going to be the pivotal screening tests. Right now, it is the clinical test and the blood test from the executive checkup, and that is why you often come across yesterday executive checkup was done, but the next day patient had a massive heart attack, or something else was detected. So those two clinical parameters and biochemical tests alone may not be enough to stratify the high risk individual for non-communicable diseases, which are a major cause of mortality in India and all over the world.
I think the awareness plays a major role over
True.
here.
So, as part of this preventive radiology initiative, we are focusing on three areas. Two, three, one, the awareness creation. Two, skill enhancement of the radiologists on preventive screening programs. Three is screening programs by itself, or by free camps or public-private partnerships. We are encouraging more and more people to get into the preventive radiology programs, get the insurance agencies interested in that, because it can significantly reduce the mortality, and thereby reduce the burden on them too. So whole system, healthcare system, the country has to be aware of this kind of tests, and the individual also, they got getting motivated because of this, and their lifespan, this lifespan and health span. Lifespan is where it's a longevity, how many years you live. But what we are going to focus with preventive radiology is health span, the disease-free lifespan. So that is the kind of quality of disease-free lifespan is what we are looking at with preventive radiology.
Understood. Yes, I mean, if our patients are aware of this, if general public is aware of such a screening program, I think when you look at how the screening programs are happening right now, with compare it with 10 years previous to this, we can see now more of general public are interested in doing the screening tests, the executive health checkups, or because they are not aware of what exactly has to be done. So at that part, maybe we all can start some screening program on this, or camping, and make an awareness program on letting them understand the importance of scanning.
True. See, this is very much important as far as cancer screening programs are concerned. Say, for example, thyroid cancers. Though many of the oncologists may not support the thyroid ultrasound as a screening modality, but it has got a huge potential. In the last 10 to 15 years, we have seen many early cancers. Many people were not aware of having a papillary carcinoma or in early stages of cancers, who got detected with help of ultrasound, and thereby followed with a FNAC or a biopsy after that. So there is a huge potential for cancer screening programs, right from mammography, which I already mentioned, other screening programs, especially with the help of radiology tests, especially in chronic smokers. A low-dose CT can pick up early lesions, and thereby improving the quality of life. So there is a huge potential. Gynec malignancies, early pickup is possible, characterization is possible. Liver I already mentioned. So there is a huge potential for these kind of applications, provided the awareness is created, screening camps are done, or even every healthcare facility provides an opportunity for the individual to do these tests.
Yeah. Uh, every time, like, as we discuss it, it all comes down to the awareness part. Now, if you talk about mammography, they'll not think twice. I mean, the general public is aware, like, okay, if I am getting a breast lump, okay, I'm feeling something over there, I am supposed to go take a ultrasound scan, or they are all aware about mammography because of the large awareness that is being created by the government and the private sectors, everyone out there. So, in such a way, they should initiate something along this line.
True, very true. So to begin with, what we have embarked upon is a liver elastography screening camps. Especially fatty liver is something that radiologists come across every day. So we should offer the liver elastography to know the liver tissue stiffness.
Yeah. Sir, yeah. So in terms of preventive screening and everything, everything comes down to the awareness part, as we always say. We'll see what we can do, and we'll see how government can also help us. I think when they are getting aware of it, they will sure
Yes.
do something about it. And so regarding the MR safety,
Initiatives. See, the MR safety is one program that I've been fortunate enough to involve with when I became a member. I've been nominated as an Asia Safe and Quality Safety and Standards Committee member of the Asian Oceanian Society of Radiology in 2021. So, MR safety was as a campaign was assigned to me from the Asian Oceanian Society of Radiology, and when we did an initial survey in the Asia-Oceanian countries, we realized that the MR safety was not being given much importance, and there has been several fatal MR accidents, including in India. Recently, also in Andhra Pradesh, the fatal MR accident happened. In Mumbai, it has happened earlier. In United States, in Korea, many places it has happened. And MRI is being increasingly being installed all over the country, and there needs to be some kind of a training program, accreditation programs, or even a MR safety board to regulate the kind of. So that is how we came out with this MR safety uh, training programs, MR safety board. Indian Radiological and Imaging Association this year has taken an initiative to form the MR Safety and Green Radiology Board, and under the leadership of Dr. Hemant Patel, I happen to be the co-coordinator for that committee. And I was fortunate enough to be the Asian Oceanian Society made me an MR Safety Ambassador for Asia. And MR Safety, what we want to have is basically the training programs, screening protocols, and devices that can automatically prevent any kind of intrusion into the MR chambers. There are enough warning signals and screening programs, screening for the patient as well as the bystanders, making them aware that MR room is MR room is not an area where everyone can easily go in
yeah.
and come out, and how to manage MR accidents, how to manage if there is something that goes if an untoward accident happen, how can we uh, overcome that. So there are a lot of aspects to prevent it is more important,
Yeah.
and this kind of awareness can prevent major mishaps. And if you ask every MR installation, every institute or diagnosis center, they will have a story to tell about a near miss. So this kind of things should be avoided by protocols, training, making the personnel responsible. That is why MRMD is a MR medical director, is a radiologist who has to be responsible. MRSO is an MR safety officer, is a technologist who is responsible. So it is his or her duty to train the staff in the not only in the radiology department, in the entire hospital, because they don't know on off hours they may come casually and enter this thing and run into all sort of trouble, or something happening in the near the MR room. They may be coming with a good intention to help, bringing in a trolley and all these
Yeah,
things,
the
and then
strong
coming
magnetics.
into.
Yeah.
So these things have happened, and that is why we wanted to create this awareness. We conducted several training programs, surveys, and now we are in the mode of having this accreditation with the MR Safety Board, and Indian Radiological and Imaging Association has taken great effort in getting these things done. So this requires a systematic campaign on a continuous basis, and to make them aware. Now
Hmm.
that the challenges here are, there are MRI centers coming up with non-radiologists putting up with teleradiology reporting happening. So there recently in one of the centers, a patient with pacemaker was entered, and that is how the death happened. So these kind of things are really, really challenging, and we need to put uh, um, some kind of a regulatory mechanism to not to entertain, not to have this kind of untoward incidents happen again in this country. And MR safety has to be given top priority, but not only by radiologists, by the hospital administrators, and the training has to be given to entire staff in the hospital, and also to the patients and bystanders also. That's why we encourage every department to have a zoning. Zoning is zone 1 and 2 is only for patients and bystanders and those people. Entry into zone 3 and zone 4 has to be strictly regulated. It should not be an easy to get into
Walking in,
zone,
yeah.
walk into this thing. So such kind of preventive protocols has to be there. And there are now a lot of industry entrepreneurship has come in, who has devised regulate mechanisms to prevent or give warning, adequate warning. Take this X-ray board where the red this thing is there, MR, all these signals has to be kept there. So a lot of things has to be done, and that is what we have been doing for last 4 to 5 years.
Right.
And this is a continuous effort, which may require some kind of a regulatory this thing, not only awareness, training, some regulatory mechanism, accreditation mechanism. So all these things are being looked into right now.
I honestly, I feel so blessed. I mean, in my very early stage of my training, my residency program, I'm getting to meet people like you who is doing a lot of things in terms of radiology. I mean, it's not only about imaging; it's about a huge preventive role there. Or there's a lot of things in the background that we have to understand
Yeah.
before entering or before becoming a radiologist. There's a lot of understanding that we should have about what we are going to deal with. So it's a vast opportunity that is being given to us, and we should be able to use it in a way that
True.
will benefit the
Yeah.
patients and general public. Sir, and I mean, not only as a radiologist, also as an entrepreneur, you are a role model for me. So, how is this like? How do you manage all this in your busy day? Uh,
So there are much bigger radiology entrepreneurs than me. I must be humble enough to say that because I know some of them are managing large systems and a large team of people with large number of institutions. But within the limited capability I have, I could manage to start in 1999, and this is now Amma Scans has crossed 25 years, and we have got multiple centers. And of course, some of the innovations that I was able to be part of or involved with was especially in obstetric imaging and fetal imaging. I was able to introduce 4D scan in Kerala, introduce cardiac CT and multi-slice CT for the first time in Kerala. So this was and was fortunate enough to innovate and invent a 4D TIFA scan. The TIFA scan is a concept that I have conceptualized and promoted from 2010. That is a targeted imaging for fetal anomalies, where all the it has to be a comprehensive pregnancy scan. It's not just routine scans and all these things, just some biometry is taken. So I've been promoting that kind of initiatives. Whenever a pregnant mother comes to the pregnancy scan should give a comprehensive assessment for not only for the structural anomalies, about the growth of the baby, about the about her fetal-maternal environment, because that is how the relevance of Samrakshan program came in 2018-19 during the presidential year of Dr. Hemant Patel. I had conceptualized this idea and discussed with him, and he gracefully allowed me to propagate it with the IRIA, forming a committee and a lot of team members. It was introduced in different states. The whole concept was, what I realized is nearly 60 to 70% of fetal deaths or neonatal deaths or even maternal deaths are happening not due to structural anomalies or anomalies or aneuploidies, but basically due to prematurity and its complications and childbirth complications due to preterm. So, how can we identify those high risk group of mothers and babies who are likely to develop fetal-maternal environmental issues and fetal growth disorders? That means basically fetal growth restriction, or a major cause of fetal environmental disorder in developing countries of preeclampsia. That is, mother's blood pressure increasing after the 20 weeks of pregnancy. So if we can identify that at 11 to 14 week screening program with the help of fetal Dopplers, the checking their blood pressure and by assessing their clinical parameters, we can identify stratify their risk, and the high risk group, which is more than 1 in 150, is given 150 milligram of low dose aspirin, and that simple measure can reduce 80% of preeclampsia in this country, 80% of fetal growth restriction, and thereby reducing the incidence of stillbirths, incidence of low birth weights, incidence of perinatal hypoxia, incidence of perinatal deaths, and thereby reducing infant deaths also, because these contribute to a large number of infant deaths in this country. So, such a simple measure, if we can identify them in a early stage, give them a low dose aspirin, monitor them throughout the pregnancy, stage the, if there is a look help with the help of Doppler, stage for fetal growth restriction, and monitor them for proper delivery. If a baby who is in distress, we are not subjective, especially with stage 3 and stage 4 where the early acidosis has set in. We should not subject that baby to go beyond that, or even for a normal vaginal delivery also. So, identifying the high risk group of mothers and babies with the help of radiology tests can significantly change the outcome. And that is what the Samrakshan program was all about. And so we successfully implemented this in many states in India, 23 states in India, with several multi-centric studies. And that has been published in the Indian Journal of Radiology, and Imaging, Journal of Clinical Ultrasound, and the international Journal of Fetal Diagnosis and Therapy. So it is documented evidence has come out in this 5 to 6 years from the Indian population, that because India contributes to 25% of perinatal deaths and maternal deaths in the world statistics. So if we can change that, the world statistics will change.
Yeah.
So that's the kind of potential this has. And when we, with a whole lot of team that has come up with some direction from all over the country as for radiologists, and then as we implemented a Samrakshan 7-star program, like the 7-star included this awareness creation, then the skill enhancement with offline and online training programs, then the Samrakshan documentation with for research publications, then there was a Samrakshan synergy reach out to other stakeholders. Radiologists, suppose radiologists say this is a high risk group, the gynecologists and neonatologists, obstetrician has to agree with that, and they should also move along with that. If they totally deny what we want to prove to them, and so the synergy meetings with them. Then the Samrakshan 757. It's an ambitious program that we have planned to reduce the incidence of fetal growth restriction to less than 10% in this country. Currently, it is nearly 30%, and the incidence of preeclampsia to less than 3%. Currently, it is nearly 10% by the year 2030.
Yeah.
And also, the 7th-star program, it is to develop a policy document from the Indian Radiological and Imaging Association to be submitted to the district and state and central administrations in this country to make them aware. And we had several meetings with ICMR, who has understood that this can work, but they are trying to figure out how that can be implemented. So that is the scope and potential of this kind of preventive radiology initiatives in obstetrics.
How do you keep up this fire inside yourself, like to do everything? And I mean, me and all, it's like a learning lesson that whenever I'm getting exhausted, also and now I have a lot of people like you in front of me that I should be like, okay, I should not I should not feel exhausted. I have to work. I have to study. I have to do this. So, how do you keep up this fire inside you to do everything?
It's I think it's nothing. Something that I don't think I am the it's my capabilities alone. It's a teamwork. A lot of people are helping you out, seeing your passion, and a lot of mentors who have given me those qualities. I've seen several role models in radiology throughout these years, and they are, everyone had a lot of good qualities I could imbibe from. And when once you develop that kind of a passion and you know it works, at some point of time you are getting a lot of team members who will actively take it forward. Maybe you conceptualize it, but the scale at which Samrakshan and preventive radiology and even MR safety has now reached, I don't think it's not entirely due to my effort. So many people have came into the bandwagon, taken proactive efforts and make it happen. Something that has happened in Guna district in Madhya Pradesh. Dr. Lilit Sharma, who heard one of this Samrakshan talks. Samrakshan attended this thing. He took it forward from them, made a change in the Guna district. Dr. Agansha Bagel, who she made a lot of difference in Harda district in Madhya Pradesh. Dr. Anjali Gupta from Agra, Dr. Bavaharan, Dr. Shilpa Satarkar from Aurangabad. So those are the people whom I never met in my life before all these things. So this happens basically because people are watching, and one thing that we continuously were persistent with what we were doing, irrespective of the negative remarks or the whatever sentiments everyone expressed that this is time
Yeah,
for you to, this doesn't work. If somebody said this doesn't work, I should always have a deaf ears for that.
yeah,
So I keep on trying and persist with that, and then it started working. So then basically I don't want the credit for myself also. That's why I said Tifa Scan was introduced by me, promoted by me, this thing, but I don't recognize myself as a promoter or this thing of Tifa Scan. It was way back in 2010. Similarly, maybe after 10 years, some direction will be owned and taken forward by so many new people who are coming into, and they will be passionately talking about it, and that's how it should work.
yes,
Something that, because it has got an end result that is good for this country, good for the nation, so it will happen for no good for the association. So there will be a lot of torchbearers coming in, and I'm not bothered about it has to be through me and nothing of that. So we are ready to give the credit. I honestly believe I've got a large credit bank with me. I'm willing to give the credit to anyone.
that's so sweet of you, sir. And I mean, before concluding, since AI is coming up, and there is a lot of question among the radiology residents also out there, some of them are a little bit scared also. I've heard that from the resident community, like, okay, fine, now AI is invading the radiology society. So, what do you have to talk to them? Tell them, like,
See, artificial intelligence is a reality,
hmm,
and human progress has always been with several universal principles. And one of the universal principles is leverage. What do we mean by leverage? Is doing more with less effort. That is how the humans have progressed ever since we found out fire, to whatever progress you right to the wheels, to all the things that has happened. The leverage is the primary thing. We can, if we can do more with less effort, it will eventually happen. So artificial intelligence is a reality. The radiologist as a profession, we have to accept that. And how can we integrate that into our practice, make use of that, and capture the services of the market that we, and dominate it. This is how we should think about it, rather than going into a denial mode about artificial intelligence. And that is where the preventive radiology, I used to say that preventive radiology has got a huge potential. In the sense, it's an asymptomatic group of individuals we are going to screen. It's not the patients who are coming to the hospital for a diagnostic workup or a therapy. It is an asymptomatic high risk group we are identifying with a radiology test. Imagine the kind of volume for a population of 1.4 billion uh, in India. The radiologists will have to do it with the help of AI only.
yes.
Sheer number of radiologists available in this country, or maybe 10 years down the line who are getting trained, are not enough to do the kind of preventive radiology workup. So AI has to be integrated into our practice. AI enabled radiology, preventive radiologist has to be the will be the new generation has to look into those kind of things rather than going into a denial mode. So whatever AI has, we have to learn AI, we have to welcome AI, integrate AI into practice, and be a leader in that AI-enabled practice of radiology. Dominate the market, interact, make yourself visible, and in interpreting it. Ultimately, even if artificial intelligence, somebody has to communicate with the patient.
Yes. Yeah.
So you have to start the radiology OPDs. You have to have form the multidisciplinary team meetings for non-communicable diseases. So these are the designs, new designs that radiologists has to adopt to uh, to meet the challenges of the new era when AI comes in, rather than going in for a denial mode and saying all the negative things about
Yeah.
this thing, which eventually AI will come into a big this thing, because there are a lot of minds and lot of capital going into that. With the whole idea, again, I said about the universal principle of leverage, which will eventually come in every field. So you cannot live in exclusion with denial mode, but then you have to accept it and become the leader and visible leader who is communicating it, interpreting it for the patient. Because patient ultimately, with a lot of information coming in, patient is going to be confused. Not only the patient, your physicians are going to be confused
Yeah.
with the kind of data that is coming in. They are going. So you have to be the integrated diagnostician with all the inputs coming in from various this thing, like even the pathology lab, radiology, nuclear medicine, all these things integrated with the help of AI. You should be the person interface to their consultants, or to your physician or surgeon, to to sum up this data and make them understand that this is how it will work, and also talk to the patient, communicate to them that this is how it's going to change their outcomes, and this is going to they're going to help them in having a better health. So we need to change, adapt to the new situations rather than going into a denial mode on AI.
And we have to understand that it's going to be a boon to us, not a curse.
Yes, of
Yeah.
course. So this is something that it's a reality. So as early as possible, AI has to be integrated. I saw the RSNA making an effort to integrate AI into residency. So they already started that. So AI will become a part of your residency program for radiologists, because
Yeah.
without that, because AI is coming in your equipments.
Mm.
So the technicians has to be aware of it, how to AI coming in your interpretation of images. AI is coming into a analysis of data coming from various modalities. So you have to be integrating this data with information alone. All this data, if given to a physician or surgeon, what is going to happen? Even now, what is happening is they may not be looking into all these things. What is from a clinical perspective, they might have had this. They will be still going in on for this thing. Very few incidents only they may go into the details whenever there is a huge mismatch.
Yeah.
Most of the time, they are not looking into that kind of a data that is coming from all the tests that they have done. Some relevant data they may be looking into, but there has to be a mechanism with the help of AI to give that red flags open up for and radiologist has to be the main person who can communicate that to
Communicate.
the patient as well as to the referring physician.
That was a nice insight, sir. And yeah, I'm not taking a lot of time of yours from your busy day, and really, I'm really grateful that that you agreed to talk on our podcast, and thank you so much.
Thank you, Prafula. So once again, all the best wishes to Gloves Off, your podcast series. I'm sure more and better insights from somebody who has been involved with radiology. There are more interviews that you will be. You will also gain. You will also gain a lot of insights into
Yeah.
radiology, and that will broaden your understanding about this modality. Thank you for inviting me, and I consider this is a great opportunity to have some time spent with you. Thank you.
Thank you so much.